So why are you guys sleeping? I don't know why they have to be sorry, because they do not have to be sorry. I don't know why we criminalize people for sleeping, because this is a natural way for us to help our body become better. In the case of children, for example, newborn from 0 to 3 months in this specification should sleep for 14 to 17 hours. As a matter of fact, infants between the ages of 4 to 12 should sleep for at least 12 to 16 hours. Toddlers for the age of 1 to 2 should sleep between 11 to 14 hours. Preschoolers 3 to 5, where many of our children fall, should sleep between 10 to 13 hours a day, of course, including napping. And school-age children who also come off to be preteens between the ages of 6 and 13 should sleep between 9 to 12 hours. And 14 years to 17 years should sleep between 8 to 10 hours. Of course, these are suggestions, so it could be lesser, but if it is too below, it could call for concern. Why should children sleep? Children need to sleep because it's part of a component that enhances their brain development. Children who do not sleep appropriately are going to suffer special conditions. It could lead to things like adverse childhood trauma, for example. It could lead to things like ADHD, attention deficiency hyperactivity disorder. It could also make them lag behind in terms of academic accomplishment, because it has to enhance the brain, the functionality of the body. Therefore, parents and teachers and family members need to have an interlocking relationship where we appreciate the value of sleep. There are foundations across the world advocating appropriate sleep. When children do not sleep, they could actually throw tantrums. They might not be able to feel appropriately. So there are implications and there are consequences. Implication could be academic based or developmental based, while consequences could be health based. You don't want to have to spend money in the future just because your child is unable to sleep. So some of the happenings in the home could also deny children from sleeping: homelessness, domestic violence, problem, lack of emotional attachment, among other things. So how much of a sleep does your own child have? And as a teacher, how do you enhance sleep in the classroom? It is important for us to know that just as the way we advocate for literacy development, emotional, physical, language development, nutrition, sleep is also one of the factors that could be responsible for amazing developmental milestones. Of course, I hope you have learned one or two things. Thank you, and bye for now.